Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So we have a dermatology expert. That's Dr. Angelo Ayar. And Dr. Ayar is located in Tamarac, and he loves what he does. He was very excited to come on the radio show and to talk about things that we all are so worried about. You know, as dermatology has taken a whole new jump here. It seems like we have this, or we have skin cancer, or we don't know about this, or then people want nice treatments. They want to look better. I've been faced with rosacea. I mean, a lot of things have come into my life that as a younger person weren't there. So I'm glad that we have Dr. Ayar to now help us. So, okay, Dr. Ayar, tell me when your patients come in, what is probably the principal reason they come there?
Well, most of my patients, and thank you for having me, Anita.
It's a pleasure.
Most of them come in for the reason that most people fear coming to Florida for, and that's skin cancer. The sun down here is hotter than anywhere else in the country, and it delivers more radiation down to the earth that our skin gets. So most people come in and they want to make sure that the spot that they have in their skin is not cancer. So it's my job to sort of determine what's normal and what's not. And that's what, I specialize in and do every single day. And most people, when they come in, they come in for a spot or two, and they want me to make sure that those are okay. And I usually reassure them on or tell them something needs to be addressed. But I always try to look over as much of the skin as possible, because bad things can happen anywhere, where the sun shines most commonly, but even where the sun doesn't shine. Just today I found a melanoma on a woman's arm. She did not even know she had a spot there, and it turned out to be a melanoma that we caught early. So that's a good thing. So it's important to be diligent, get familiar with your skin, and make sure your dermatologist is looking at your skin as well all over to make sure that things get caught and taken care of early so they don't impact your life expectancy.
That's very good advice. So let me move with that a little bit. So now you're saying that the sun can actually bother you even if you have clothing over your arms or legs. So when you said about using, we have to, use protection.
I wouldn't say the sun. So that's where the sun doesn't shine, cancers can arise, and those are mostly from genetics, things that they're not environmental, things you can't control, something that you're born with. So some people have a cancer predisposition, so they can get cancer where the sun has never shone before, and that's less common. But as a dermatologist, it's my job to check to make sure that somewhere you don't expect something to happen, I make sure that it doesn't. And once in a while, it does, and we take care of those areas. But certainly, protecting your skin from the sun is something that we all can do to reduce our risk of getting skin cancer and bad things.
So you're saying that in the morning before you go out, you should lather yourself with your protection?
Yes. So one of my professors would tell every single patient who walked through the door about a study that they did in Australia a few years ago, probably 5 years at this point, where they had one group of people who wore sunscreen every day before they left the house in Australia. And then the other group of people, they only wore sunscreen when they went out in the sun, what they considered being out in the sun, like going to the beach or doing outdoor activities. And after, the study period was over, they found that people that wore sunscreen every day before they left the house had a 50% decreased chance of developing a skin cancer than the people who only wore it when they thought it was necessary.
Wow.
So in the state of Florida, the sun is, really hot. So if you really want to be diligent in reducing your risk of skin cancer, also reducing your risk of getting sun freckles and the brown spots that many people don't like, and thinning of your skin, which causes, skin tearing or just bruising. Some people don't like the bruises that they have on their arms from, the sun that they get, wrinkles, discoloration. All those things are caused by the sun. So you protecting yourself protects against all the things that you don't like, not just skin cancer, but that's certainly the most important.
All right. So as a woman, when I get finished putting my, conditioner and then I put my makeup on, do I put it over that or do I put it under? Where do I put it?
Great question. So there isn't a consensus on that. Some people might say either way. I would certainly say for most women, it doesn't matter. Just getting it on is the most important part. But if you wanted to split a hair there, and people might agree with me, some people might not, but I think putting it on in the way that's most convenient for you works best. So if you're putting on a sunscreen that you like to put on over everything, do that. But I know it's hard to put on sunscreen over makeup, so I usually recommend people to put on their sunscreen underneath, give it a few minutes, let it dry, and then do your makeup. And you can even use a sunscreen and a moisturizer to make sure your skin is nice and moist, so your makeup sits like you want it to.
Right. And so underneath, that's probably what I prefer anyway. And it's going to make your face just too wet looking, or too too creamy looking. If you use too much on your face.
No, you just sort of rub it in the best you can. The more the merrier, actually. Most people, they did another study that found that most people only use about a third of the sunscreen that they really need to use to protect themselves from the sun. So they're only using about a third of the necessary amount. Cover your whole body. They with the AAD, which is the American Academy of Dermatology, they recommend about an ounce, which is about a shot glass full of sunscreen for the whole body.
Really?
If you're doing just like the face, maybe like a tablespoon or two to cover, or just a tablespoon for the face. So you just sort of grade it from there. If it's creaming, you just sort of try to rub it in the best you can and cover it from there.
And I can't put things on my back myself.
Right. What I do now is I try to wear SPF clothing because I feel like that's the easiest and best. But for people who want to go out or show skin, I recommend that they get like applicators, or if they don't have somebody around to help them, there's applicators, which are basically like sticks with a sponge on the end. And you can put the sunscreen on the sponge and then sort of rub it on your back just like you would a loofah in the shower.
Okay.
Yeah.
This is a great conversation. I don't.
Thank
Most
you.
dermatologists wouldn't be. You're great because you understand. It's so practical. Where usually when somebody's sitting with you, they're not going to ask you these practical questions. It's pretty, scientific. But thank you. That's helped me.
Yeah.
I'm gonna go back and do that.
Yeah,
All right.
I can go both ways. So I can bore you with the science and the numbers if you want. But most people, all they're going to get out from a conversation or what you tell them is sort of a couple of things. You're only going to be able to give somebody a couple of pieces of information they're going to take with them. So I try to keep it as simple and practical as possible, because no matter what we know about something, if the only way we can prevent it or improve it is by having people change their behavior. And the only way people are really going to do something that the doctor recommends is if they can manage it or if it fits into their lifestyle. People don't want to do a lot extra to, do these sorts of things. So, people ask me what sunscreens are best, but I tell them what sunscreens are best. But the best sunscreens out there are the sunscreens that you use, the sunscreens that you like,
That's good advice.
So if you have a sunscreen that you love, use it,
Right.
And if there's ones that you hate and that I love, don't use those. So I try to keep it simple,
Right.
so people do those things and not restrict them too much. Give them choices so they can go out and find something that they like and that they're happy with and they have control over, and they can choose, and they don't have a lot of fear about them doing something wrong or restrictions. I just keep it simple and let them know kind of the basic facts.
Well, I want everyone to know this very, very charismatic, interesting dermatologist who's full of all these tips is Dr. Angelo Ayar, and he is. I'll give you his phone number. Remember, this is Pencil Talk Radio, so if you're looking for a really interesting dermatologist, not only is he medically equipped, but he's got a great personality, and I think I like that because this is serious stuff, but yet sometimes people, dermatologists or other doctors, talk way over our head, but he doesn't. He's really very down to earth. So his phone number is 954-726-2000. Easy number, 954-726-2000. And he's located in Tamarac, and his website is derm-experts.com. derm-experts.com. Okay, so now when you say that you can just look at someone, do you have to do biopsies to know for sure?
Yes. That's the simplest way to put it. To know for sure, you have to do a biopsy, because you make a clinical diagnosis, which is based on what you see. So I can be 99% sure about something, but I can never be 100% unless there's a biopsy. So usually if I'm very sure in the 90 percentile and I'm sure it's going to be fine, I say we just sort of watch it. And if it stays the same and doesn't change or grow or bleed, we leave it. If I'm 50-50 on something, I'll tell the patient, I'm not quite sure about this one, and I can't say either way. It's got some features that kind of go either way. So for those scenarios where something could potentially be bad, I offer them a biopsy and try to remove it. We just numb it up with a little bit of lidocaine, and we just take a tiny piece. Sometimes the whole thing if it's a mole, because you have to analyze the whole mole, because some parts of the mole could be melanoma and some parts not. And then we put that in a bottle, we send it to a lab, and then there's another doctor called a pathologist who reads it, and they read the cells and look at the cells, and they tell me what it is for sure. So to repeat what you said, to know for sure you need a biopsy, but usually dermatologists can tell most things, whether they're going to be cancerous or not, just by looking at them. And sometimes they don't know, and they do biopsies for those.
That's really, see, I'm so surprised that your eyes are 3D, I guess, that when you look at something, you said you just look at it and say, oh, that might be something. You look, I don't see anything, but you do.
Yeah. Yep.
That's
that
called
just
experience.
Yes. Study and experience, definitely.
Okay. Well, let's just go down the list here. So a lot of us do have moles, moles, and we have lived with them for a long time. What's the danger in having a mole?
No danger. A mole is a benign cluster of mole cells. They're called melanocytes. Everybody has moles pretty much, and all of them are not dangerous and don't cause us any problems. That collection, those cells grow, live a life, and they die and stay in equilibrium throughout your life. So they grow and they're regulated by your body. They do what they're supposed to do forever. For certain reasons, part of it is your genetics, just your genetic predisposition. And the other risk factors, like we talked about earlier, like sun exposure, blistering sunburns when you were young, tanning bed use, things like that, that radiation can cause a mutation in one of those mole cells or one of the skin cells. So that radiation causes a mutation, and the breaks in the cell, machinery that tells cells to stop growing and die, those can get mutated and go away. And so the machinery and the signals that say stop get mutated and go away, but the machinery that says grow, continue to grow, and proliferate, those stay on. So there's no brake pedal, and you have your gas pedal still on. It's going to just go without being regulated and stopping. So that's the definition of cancer, which is something that grows without regulation. It doesn't stay in equilibrium. It's just unregulated. There's no stopping a cell from just continuing to grow. And unless you do something about it, it'll grow and grow and grow.
Wow. Okay. Well, so you have to. That's something you said. I guess you wait and watch about things that you're not sure.
Sometimes you can watch. If you're not sure, sometimes, depending on how it looks like, sometimes I'm not comfortable waiting. Sometimes I'm saying, I'm not too worried. When we see you next time, we're going to keep an eye on this one. We'll measure it, maybe take a picture, and we'll see what this looks like next time. If it looks a little bit different, we're gonna remove it, because moles shouldn't be changing. Moles should stay the same every month. The only way it should be changing is if it's mutated and it's growing when it's not supposed to. So if it's doing that, then we'll take a biopsy. And I have the patient look once a month, not every day, once a month in the shower or whatever. Take a look at it once a month, maybe on the first of every month. If every month it's staying the same, you're probably okay. It's probably not changing. If month after month, you're noticing, hey, it's got a little streak coming out of it, or the color changed a little bit. Any sort of change, you can't really. Your eyes are not microscopes, so you can't really see. You can only do the best that you can. If you have any sort of those inklings, that's a sign that something not right is going on. It should be investigated with a biopsy.
I see. Yeah, that's good. Well, so when someone comes to see you at Dermatology Experts, do they take off their clothes and you just look everywhere, or how does that all work?
Well, when they come in, We sort of leave it up to them. I have everybody sort of get into a gown, like take off their clothes and expose as much skin as possible. Usually people leave their underwear on, and I put them into a gown, and I just work around the gown to try to check as much skin as possible. And for some patients, they want everywhere checked, no inch uncovered. They want every single part checked by the dermatologist. And I do that. Some patients say, I check these areas and they're fine, or for females, they have a gynecologist who checks that area, so I just sort of defer it to them. Or, I just ask them if they want those areas checked or not. And if they do, I do. And if they don't, I don't. I just make sure that they check it, or their primary care doctor takes a look and things like that. But I look over everywhere else, everywhere from your scalp. I'll look if you have a history of melanoma. I'll look inside your mouth and your eyes the best I could, in your ears, behind your ears, and just every inch of skin that I can to make sure that everything looks in order.
Right. Well, that's good. Well,
it doesn't
how
take
long?
terribly long, too, depending on how many spots you have.
So how long does that take?
Yeah. So if you have a lot of spots on your skin, it could take anywhere from 5 to 10 minutes.
That's nothing.
No, and that's if you have just a lot of spots. If you're somebody who has, just a few spots, there's not that much to look at. There's not that many things to look at, and there's not much going on. Those can take from 2 to 5 minutes. Like I said, you can at this point, board certified dermatologists with a lot of experience can look at something and tell within a matter of seconds whether it's good or bad.
I see. So thank you. Okay. Well, I'm glad that that we've had that conversation about this. So let's talk about, I guess, the one thing that we hear about shingles, and there are all sorts of things that we can do about them. That we can think about. There are inoculations that you can do to prevent shingles, and when they happen, what happens?
So shingles is chicken pox that's rearing its ugly head again at some later time in your life. So everybody who has shingles had chicken pox at some point in their life. And chicken pox, when you get that, the spots go away from your skin, but the virus remains dormant in your body for the rest of your life. And your immune system keeps it there and doesn't let it rear its ugly head. But as time goes on, our immune systems weaken a little. Or if we go to the hospital or have major stressors in our life or have a lot of sun exposure, like get a burn, the immune system gets weakened and the virus has room to proliferate and cause lesions on the skin known as shingles. So it's herpes zoster virus that's sort of reemerging from a previous infection. So that's what it is. And what can we do about it? Well, it's a terrible thing to have. For most people, it's very painful. When it first comes out, it can be contagious to people who've never had chicken pox before. Babies, or if a woman is pregnant and she's never had it before, she's not or hasn't been vaccinated against it. And then in the first few days, you develop these blisters that sort of rupture and leak a little bit of fluid, and that's when it becomes really painful because the virus lives in your nerve, so it's literally growing out of your nerve. That's why it causes all the pain. When you have it, it's best to see a doctor who's familiar with treating it right away. And if you catch it early enough, you can be given medicine that decreases the duration of the rash. So if you let it run its course, it could take a week or two. But if you catch it within the first 72 hours, you can decrease the duration of the rash by up to 50, 75%.
Really?
Depending on how early you can get it. So if you get treatment early, you can get the rash to go away pretty quickly. And the longer the rash stays, the rash eventually goes away. Typically, in most people who have immune systems that come back to life and keep it and knock this thing out. But the pain that you get from the shingles is called post-herpetic neuralgia. It's nerve pain from this herpes zoster virus that can remain for months to years after. So it's important for me when I see it to treat it early and aggressively to sort of try to prevent the post-herpetic neuralgia from happening. So when you get it, it can be treated. Find somebody who has experience with it. We certainly do in this office. I see it probably at least once a week. And the other thing is, if you don't have shingles, at a certain age, we can get a vaccine to boost our immunity to it.
Right, right.
So, and that's something your primary care doctor can do. So you can visit your primary care doctor's office and say, hey, I'm worried about shingles, and they'll tell you if your risk factors and your age are important in determining whether you need to have, a vaccine booster, or if you have any sort of condition that requires having a vaccine booster.
So you would not give the shot there?
I don't do the vaccines in my office now. I would
see.
usually send to a primary to do that.
I see. Okay.
Yep.
I understand. All right. I want to tell you something. I have, I know people, and I see it advertised all the time about psoriasis.
Mm-hmm.
I had a person work for me once, and she was loaded with it, and she was so embarrassed all the time.
Man. Yeah. Okay. She was loaded with it all the time.
I mean, she had it all over her arms, her legs. It was terrible.
Yep. So psoriasis is terrible. I was lucky that where I trained, we did, maybe, more, just as much psoriasis research as anywhere else in the world, actually.
Really?
So they did a lot of psoriasis research where I came from. So I know I'm fortunate to have a lot of experience with it, and it's a very pesky condition. And it comes in a lot of different shapes and sizes and areas and things that it does. But for the most common type, which is probably the type that your friend had, it's called plaque psoriasis, chronic plaque psoriasis. That's like the disc-shaped, red, flaky spots all over. That's the most common form, and that's the one that kind of can break and cause a little bit of bleeding and flaking everywhere, and people are it's just unsightly, and people get really self-conscious about it.
Right.
Luckily, there are more treatments and very advanced treatments that can clear almost any type of psoriasis now than ever.
Really?
And the choices are very vast, and every year we seem to get a new member of a new medication or a drug that joins the party that treats a specific kind, or it just becomes another option. So the treatment ladder for psoriasis is very vast, depending on how much you have, where it is, and just your specific type and what you're able to do, or any other conditions that you have. So if it's very mild, you can treat it with creams. If it's very severe, you can treat it with shots. There's even infusions. There's even pills now that you can take for psoriasis if you don't like shots. And depending on where it is, certain treatments do better in certain areas. So there's a lot of treatment options for psoriasis, and there's a lot of new treatment options for psoriasis. So anyone who I would say is loaded or just has it somewhere that's pesky and they don't know what to do, if they find a good board-certified dermatologist who has experience with the vast array of psoriasis medications, I would have them, see them in consultation to see if there's something that they can do, and almost all the time there is.
That's a great explanation, and I'm sure that if people have it, you want to go to a doctor who has that kind of experience. I'm glad you made it sound so easy, and she's lived with it. Of course, we see it on television. There's certain kinds of medication that they talk about, and then people act like they don't have it, and they're not embarrassed anymore.
Yeah. There's certainly, I try to keep it simple up front, and I let the questions arise when they may arise. So the short answer is yes, there's definitely something that can be done. You just need to find somebody with experience so they can guide you in the direction that you're comfortable going to get this under control.
Okay, now this is the big subject. Cool Sculpting. It's a great name. Tell me what it is.
Cool Sculpting. So Cool Sculpting is something that was invented by somebody in South Florida, actually, about 10 years ago. And it's based on something called cryolipolysis. What's that? Well, it's freezing fat. They found by chance that if you freeze fat to a certain temperature over a certain period of time, it will destroy the fat cells, and your body will destroy them and whisk them away, and you'll be left with less fat in a certain area. It's non-invasive, meaning there's no scalpels, injections, or cutting involved, and it's something that you can do in an office setting with little to no, very little risk, and you can go about the rest of your day or go to work right after. Most treatments are 30 minutes to an hour, and when you leave the office, you just go about the rest of your day, and it can sort of treat any sort of trouble areas of fat that you just are stubborn and you can't get rid of. This machine can treat those areas with this technology.
Is it pretty new?
It's 10 years old, so I would say in the world of non-invasive cosmetics, it's not that new. Things are even coming out every few months. Something new is coming out, so it's not that new. And the product has been around so long that many people. It's becoming a more well-known name. So it's almost like a household name now. Is CoolSculpt. But when I first got introduced to it about 5 years ago, when I was in my residency training, it was a new idea that a lot of people knew about. Now it's almost everybody knows about it, and everybody asks me about it. So it's a very proven treatment option for fat reduction.
Right.
We're really excited to have it in our office now.
Well, that's wonderful. Well, I'm so glad. I know that you have a patient now, and we've had a wonderful conversation. Thank you so much for taking your time. I've learned a lot, and I'm sure our listeners have too. So thank you, Dr. Ayar, and we'll talk again.
It's always my pleasure. Have a great day.
You
We'll
too.
talk again soon.
Yes, the number is 954-726-2000. Make an appointment.
All right. Thank you, everybody.
Thank you. Bye.
Bye-bye.